pretty easy to just review the review article. Since I was supposed to disclose my relationships, I thought, and I don't have any, I thought I would disclose the authors, because I do think it's important. And I don't mean this bad, but Doctors Hall, Dart, and Bogdan are members of the Cyanokit Advisory Board, which is hydroxycobalamin. I think most people in this room already know that. So, cyanide poisoning, they introduced cyanide in the background initially, and cyanide poisoning occurs in the settings of suicide, homicide, chemical warfare, genocide, and enclosed space fires. This article mainly dealt with cyanide poisoning from enclosed space fires. Cyanide binds to cytochrome oxidase and other enzymes, producing cellular hypoxia, which leads to CNS and cardiovascular dysfunction. And as the article states, the empiric treatment is based on clinical findings, which they list as hypotension, altered mental status, elevated lactate over 10 millimoles per liter, and relatively normal oxygen saturation. So antidotes for cyanide poisoning include amyl nitrite, sodium thiosulfate, hydroxycobalamin, dicobalt EDTA, and 4-dimethylaminophenol. But they state in the paper that only sodium thiosulfate and hydroxycobalamin are suitable for empiric therapy. And this is due to the hypotension and methemoglobinemia that may occur and might be problematic in someone who is in an enclosed space fire. So the purpose of this article was to evaluate and review literature on hydroxycobalamin and sodium thiosulfate monotherapy. So it starts with the efficacy of hydroxycobalamin. It acts by binding directly to cyanide to form cyanocobalamin, which is then renally excreted. And in vitro, it's been shown to penetrate cells and act intracellularly. In animals, it's been shown to cross the blood-brain barrier, so these are all good things. And in dogs, it also was shown to increase blood pressure and lead to survival without neurologic sequelae. When listing the human studies and case series, they list 2 human studies regarding smoke inhalation, one prospective and one retrospective. The first prospective study is really an observational case series of 69 patients. They say that 37 were comatose, 14 in cardiopulmonary arrest, and they were given anywhere from 5 to 15 grams of IV hydroxycobalamin, and there was a 72% survival. There was no control group here, and cyanide levels were measured in some, but we don't really know which ones. Many of these patients got HBO. This isn't really in the article, so I don't know how relevant it was, but just, to clarify that it says it's a prospective study, but there's no control group. We don't hear anything about cyanide levels or anything like that. The one retrospective study is 101 patients, 72 of whom had their survival status known. 42% of those survived. 38 were stated to have been in cardiac arrest, 21 had return of blood pressure, 12 were hemodynamically unstable, and 9 of those recovered their blood pressure in 30 minutes. That study did not have any cyanide levels at all. So, just for what it's worth, I don't know if we can really count them as studies. But the case series, individual case series, and reports suggest efficacy. Safety. Well, hydroxycobalamin can cause a reddish-brown discoloration of the skin, mucous membranes, and urine lasting several days. They say that this may complicate burn evaluation. It may interfere with colorimetric assays for liver enzymes, bilirubin, creatinine, CK, phosphorus, glucose, magnesium, and iron, although they say that this is not of major clinical significance. And the safety, it can cause allergic reactions, hypertension with reflex bradycardia, although this is self-limited, and they suggest that this actually may be beneficial because we're more worried about hypotension. So if anything, it might cause a little hypertension. And normal volunteers who received hydroxycobalamin had headache and chest pressure. Some of them did. So moving on to efficacy of sodium thiosulfate. This acts by converting cyanide to thiocyanate through action of the enzyme rhodinase. And the sodium thiosulfate has limited distribution to brain and limited penetration into mitochondria. And the rhodinase, that's where the rhodinase is. So for animal studies, when given to rabbits poisoned with cyanide, 7 out of 10 still died. And they state that when given alone, sodium thiosulfate actually decreased the time to death in poisoned animals. However, in rats, it decreased blood cyanide, lactate, and venous PO2, which suggested efficacy. And in humans, there's no studies, but there are lots of case series and reports, and these are also associated with survival. As far as safety of sodium thiosulfate, dogs given very high doses, 3,000 milligrams per kilogram, as opposed to a typical human dose of about 180 milligrams per kilogram, developed metabolic acidosis, hypoxemia, hypernatremia, and hypotension. And normal human volunteers given sodium thiosulfate had some nausea and vomiting. They do comment that there is concern for chemical interactions if they're administered together, so hydroxycobalamin and thiosulfate shouldn't be given through the same IV, and there are no comparative studies of the two. So their conclusions. Evidence for both hydroxycobalamin and sodium thiosulfate monotherapy is incomplete. They say that hydroxycobalamin seems to be an appropriate antidote for the empiric treatment of smoke inhalation and other suspected cyanide poisoning for victims in the out-of-hospital setting. Sodium thiosulfate can also be administered in the out-of-hospital setting. And then another conclusion is the onset of antidotal action of sodium thiosulfate may be too slow for it to be the only cyanide antidote for emergency use. I can't help it, I questioned that a little, so I did some digging, and I found a very nice letter by Dr. Kearns and Dr. Bueller, Dr. Tomaszewski, that I just think fills in the gaps. So I couldn't help but just add it in there to check it out. It just fills in a few gaps, but that's it.